Okay, so this is the second time I'm going live on YouTube and or liking this live video. So from the title of this video, you know what we want to talk about. Today we'll be dissecting delegation and prioritization for the Nclex. So I have the textbook with me for those of us who are not able to reach the textbook, or maybe it's expensive and you can't afford the textbook. So this is why I'm doing this video, so we can go through it together. If you have any questions, you can drop them on the comment section. If you have any contribution to make, you can also drop them on the comment section. I hope you all can hear me and see me. Okay, so let's get straight into the video. Forgive me if you're hearing any background noise or voice, just ignore them and focus on the main reason why this video is being done. So like I said, we'll be talking about delegation and prioritization. The Nclex is a safety exam, so regardless of whatever questions you might be asked, they want to test your knowledge on safety. They want to test if you're a safe nurse, if you can be able to care for their patients with safety at the back of your mind, if you're able to keep your patients safe whenever you are being assigned a patient to take care of. So that is what you should know, and always have it at the back of your mind that this exam is a safety exam. So for anything you're doing, make sure your patient is safe. That is the priority. That is the first thing you should consider. So like I said, we'll be looking at delegation and prioritization. So first of all, from the word delegation, delegation is to assign a duty to a particular person, and it should be done in a way that that duty is safe for the person. The person has been tested and will I say tried and proven competent to handle. Here it says delegation is a process of transferring performance of a selected task in a situation to an individual who is competent and has the authority to perform the task. Like I said, when you're delegating a duty to another nurse, maybe you're a senior nurse or you're the child nurse, and you're expected to delegate a duty to the junior nurse or to another nurse, you should have it at the back of your mind that whoever you are delegating this duty to should be competent enough to handle this task. This person should be competent enough to handle this task. This person should be competent enough to carry out this task before the task, like I said earlier. So it all depends on hospital policies and protocols. It differs and varies. There are different hospitals, different protocols to which a task is being delegated to another person or another nurse. And there are 5 rights of delegation. Have this at the back of your mind. When you see a delegation or prioritization question, have this at the back of your mind for a delegation question, that there are 5 rights. For example, you are delegating a duty to a nurse, it has to be the right task. Or as a registered nurse, you are delegating a duty to an LPN, it has to be the right task. An LPN is licensed practical nurse. It has to be the right task you are delegating to that LPN. It has to be the right task. For example, you don't tell an LPN to carry out you don't tell an LPN to feed a patient that just started feeding, or maybe went for a you don't tell an LPN to carry out health assessment on a patient. So as the nurse is supposed to do that. So that is for the right task. Then right circumstances. The circumstances has to be favorable for whoever you are allocating the duty or task to. So it has to be favorable. It has to the circumstances has to be right, if I may say. For example, like I said earlier on, maybe a patient who was stable started manifesting signs and symptoms of angina pectoris, and then because this patient was stable, instead of you, the registered nurse, to go and assess this patient, you are telling a licensed practical nurse to go and assess the patient. That's very wrong. It is not the right circumstances under which you are assigning an LPN to go and assess the patient, because patient just started presenting with signs and symptoms of maybe it's the angina pectoris. It's an acute onset of the signs and symptoms. It's happening initially. So you as a registered nurse is the best person to go and assess that patient rather than delegating the duty to maybe an LPN. Yeah. And the next is the right person. It has to be the right person who you are delegating this duty to. It has to be the right person. And then right direction of communication. So for example, when it comes to right direction and communication, for example, you are delegating the duty to an LPN to actually maybe monitor a patient vitals and get back to you if okay, for example, let me use a stroke patient. So there's a stroke patient, and maybe the patient presented with an hemorrhagic stroke, right? And you know, for hemorrhagic stroke, you want to maintain a blood pressure that is not above 180 over 110. You don't want this patient to have a blood pressure that is going to spike, and then patients will start bleeding out so massively in the brain. And you know that this patient blood pressure should not be above 180 over 110. So now you're assigning an LPN to, keep on monitoring the vitals, and you just told the LPN, hello, please monitor Mr. A, directives of what to do if that blood pressure exceeds 180 over 110. So it's supposed to be, hello, please, can you help me monitor patient A blood pressure? Please, when is above 180 over 110, can you get back to me on that? That is the right communication. That is the right direction. You've actually given a precise direction and communication to whoever you're assigning or delegating that task to. So if you didn't do that, or if you don't do that, the LPN will just keep on monitoring the blood pressure. She doesn't even know, or he doesn't know what he or she is monitoring. If the blood pressure is up to 180, 110, what would the LPN do? She just keeps on monitoring because you didn't give her a right direction, or you didn't communicate in the right way to her. So that is another thing to be very careful about. It has to be the right direction and the right communication. And also lastly, the right supervision and evaluation. So whatever you are doing, it has to be right. It's the evaluation and supervision has to be in the right way. You don't just assign a task and go to sleep, or you don't just assign a task and go to fold your hands. It has to be the right evaluation and direction and supervision. So that is it for delegation. So there are some principles and actions. So the first here says delegate the right task to the right delegatee. Be familiar with the experience of the delegatees, their scope of practice, their job descriptions, agency policy and procedures, and the State Nurse Practice Act. Like I said earlier before, hospitals and different states board of nursing, state board of nursing have their policy act. They have different approach to different things. Each one of them are not the same, so they vary. So it depends on the facility you're working in or the facility you find yourself. So you should know their policy. Provide clear directions about the task so that the delegatee understands the expectations. Like I said earlier, right direction and communication. So you want to be sure that the delegatee understands what you've asked him or her to do. Determine the degree of supervision that may be required. Provide the delegatee with the authority to complete the task. Provide a deadline for completion of the task. So there should be a deadline. You don't just delegate a duty and everybody goes to do whatever he or she wants to do. There have to be a guideline when you delegate a duty. Like I made an example of a patient who presented with an hemorrhagic stroke, and you're trying to monitor the blood pressure not to go above 180 over 110. So there is actually a guideline, there's actually a deadline to what I delegated the other person to do. Provide feedback to the delegatee regarding his or her performance. To provide feedback, you have to give performance evaluation to the person. You have to tell the person how, oh, you did well, or you didn't do this, you didn't do that, and here is how to go about it in the future. So you don't just ask someone delegate an assignment to somebody, and when the person does it, you don't give feedback, you don't do anything about it. It's either you're saying a thank you, or it's either you are grateful for the assignment well done. And if the person didn't do well, you also, positive criticism, right? The other one is evaluate the outcome of care that was delegated. So you have to evaluate the outcome of care, the care that was the assignment that was given to the person. You have to evaluate the outcome. Was it a positive outcome or was it a negative outcome, to know how to go about it in future, and to know if you would still give the person the same assignment, to do again. In general, non-invasive interventions such as skincare, range of motion exercises, ambulation, grooming, and hygiene methods can be assigned to the assistive personnel. So we have the registered nurse, we have the licensed practical nurse, and we have the assistive personnel. So bear it in mind that when it comes to activities of daily living, when it comes to grooming, when it comes to taking care of a patient's well-being, from grooming to range of motion exercises to ambulating a patient to hygiene assistive personnel, all of this can be assigned to an assistive personnel. Bear that in mind, do not forget. In general, a licensed practical nurse, which is known as an LPN, and patient and job prescription of the LPN. The LPN can also collect data and also review with the client teaching plans that were initiated by the registered nurse. So what this is actually trying to let you know is all the things I mentioned that an assistive personnel can do, an LPN can do all of them. Yes. So whenever you see a question that has some of these things I mentioned, and in the option you see an LPN or a registered nurse, the answer should be an LPN. Or maybe you see an LPN and an assistive personnel, and maybe there's something else that the LPN can do that is in that option, you go for the assistive personnel. I don't know if you understand. Okay, for example, you have a question like, which of these is medications? B, bathing of patients. C, feeding of patients. 3, ambulating a patient. What do you think is the answer? What do you think is the answer? So because I said an LPN can do all that an AP can do, does not mean you would leave the work of the LPN and go and pick the answer of an assistive personnel. What do I mean? The answer to this question is oral administration of medications. Reason is this: feeding of patients, grooming of patients, ambulating a patient is the role of medications. Administration of oral medication. So leave those ones for the AP, which the assistive personnel can do, and go for the one which you are very sure that an LPN can do. Like, it is the main duty of an LPN. I don't know if you understand what I'm saying. So an LPN can also do some things that a registered nurse can do, but with a limit. For example, an LPN is only delegated administration of oral medications, IM medications, sub-Q. Do not fall for that trick. An LPN does not give IVs. Only a registered nurse is to do that. An LPN does not give intravenous medications. They are only limited to giving orals, subcute, and intramuscular. Yeah. An LPN can also perform some activities like changing of wound dressings and also urinary catheterization. This is an invasive task that an LPN can do. Inserting a catheter. Yeah, an LPN can do that. An LPN can also change dressings, wound dressings. Remember, I said an LPN does not give or should not be dedicated to administer an IV medication. Please and please don't fall for that trick. An LPN should not be delegated to give an intravenous medications. I am sounding it and I'm sounding it again. So now, what does the registered nurse, which is you watching this video, What are the things that you don't delegate? What are the things that you should do by yourself? No matter how tired you are, no matter how burnt out you are, if you're not delegating it on another registered nurse, you should not delegate it to what an AP can do. That's when I mean AP, I mean assistive personnel. So a registered nurse can do every other, can actually do, both the LPN's work and the AP work. So a registered nurse is responsible for assessment of a patient. A registered nurse is responsible for assessment of a patient, especially from the emergency department. A registered nurse is responsible for assessing a patient from the CMS down to the integumentary system, the urinary system, the renal system, all of the systems. This is the work of a registered nurse. A registered nurse is also responsible for planning of care. A registered nurse does not delegate her planning of care to a licensed practical nurse or an assistive personnel. You don't do that as a registered nurse. You don't delegate planning of care. It is solely the responsibility of a registered nurse. Yeah, you heard that. A registered nurse initiates initial teaching, while an LPN can reinitiate the teaching. What do I mean? For example, the patient is for discharge, right? And maybe this patient is diabetic, and you need to teach the patient on some certain food that the patient should eat, or some certain things the patient should do. A registered nurse is solely responsible for that act. You don't delegate it to a licensed practitioner. Oh, can you go and educate Mr. A on? You don't do that. As a registered nurse, you should be the one to do it. The licensed practical nurse can only reinitiate that teaching given before the one who does the initial teaching. Is that okay? Now, a registered nurse also administers medication intravenously. I've said that before, that on no account should a registered nurse assign intravenous medications to be administered. You don't assign an LPN, you don't assign an assistive personnel to administer medications. That is very, very wrong. And it is, you're not putting your patient, you're putting your patient at risk. You're not being a safe nurse. You're not being a safe. And a registered nurse can care for stable and unstable patients, while a licensed practical nurse can only care for stable patients, same as the assistant personnel or the vocational nurse, whichever one. But a registered nurse cares for both stable and unstable, while the licensed practical nurse only cares for stable patients. And when I mean stable, you know what I mean. Not physically ill, patients whose vitals are very normal, who can ambulate, who can do one or two things for themselves. But a registered nurse cares solely for only stable and unstable patients. An assistive personnel provides basic care that does not require any type of assessment. So before, activities of daily living, bathing, grooming, all of that they can perform. Now, I think that is that for delegation. I think that is that for delegation. So let's go to prioritization. So when it comes to prioritization, from the name, you already know what it means. You already know what we're going to talk about. So priority, coming first. What do you do first as a nurse? This also tests your safety. In fact, that is even the main thing. When you write the Nclex, there is no way you're not going to see prioritization questions. You are always going to see them because they want to test your safety. So you're always going to come across prioritization. Decide prioritizing. What do you intend to achieve? So you want to isolate immediate needs and problems, and you want to carry out immediate action for a patient. There should be no delay when it comes to prioritization. Yeah, there should be no delay. And from the definition here, it says prioritizing is deciding which needs or problems require immediate action and which ones could tolerate a delay in response until a later, differentiate between needs that are urgent and are not urgent that you can attend to in a later time. That is what you're trying to do when it comes to priority. So the nurse and the client mutually rank the client's needs in order of importance based on client's preferences, expectations, safety, and physical psychological needs. What the client sees as his or her priority needs may be different from what the nurse sees as the priority needs, and it can be classified as high, immediate, or low. So now, for example, you have RTA patients who came in to the emergency department, pressure points, and patient says, I want water. Now, for the patient, taking of water is his own priority, right? But as a nurse, you're seeing something different from what the patient is saying. You're seeing that this patient is bleeding out. And if you don't put an IV access and start normal saline, if you don't arrest that bleeding, patient will bleed out and die. So would you go for the patient's own priority needs, or would you go for your own priority needs as a nurse who is seeing the patient? Do you get the gist? Or do you get what I'm saying? So patient priority needs, and carry on and do what is supposed to be done. Priorities are classified as high, immediate, and low. Client needs that are life-threatening or that could result to harm to the client if they are left untreated are the high priorities. For example, let me use another example. Trying to look for a disease condition. Okay, for example, when it comes to autonomic dysreflexia, you know that irritant stimulant is what is affecting this patient, and patient will now present with hypertension, tachycardia, high body temperature, and all of that. Now, as a nurse, you know that if you don't do something about this problem, patient might die. It might lead to complications that are irreversible. So now, as a nurse, you know that okay, irritant stimulants is what precipitates or what causes autonomic dysreflexia. Now, patient has high blood pressure. You're supposed to maybe administer IV medications. Maybe in the option you see that they are asking you to like reposition the patient or raise the head of the bed, and another option says do a digital rectal examination and check for impacted feces or distended abdomen, a distended bladder for urine. As a nurse, what do you think should be the answer to this question? The answer obviously is assess for bladder distension and impacted feces. That is the answer. So now you are trying to think of what to do first. What do you do to save this patient life? What you are removing that causative factor. What is causing the problem for this patient? High blood pressure is not this patient's problem. Elevating the head of the bed is not this patient's problem. Proper repositioning is not this patient's problem. What is the patient problem is the impacted feces and distended bladder full of urine. That is what. Non-emergency or non-life-threatening clients need immediate priority, so theirs can come later. You can give them feedback or go ahead with their own treatment in a later time. But for the high people, for the high priority needs, you have to meet their needs ASAP, as soon as possible. Now we also have client needs are not related directly to the client's illness or prognosis, and they are called the low priorities. And then the nurse can use the ABC. This is one trick or one. So when it comes to prioritization, you have to check for airway first. You have to ensure that the airway of this patient is not compromised, which includes oxygenation, saturation, um, obstruction in the nostrils or in the throat. Anything that can occlude the airway should be considered. And now breathing has to do with respiration count. Then when it comes to circulation, it has to do with blood circulation in the body, trying to prevent pallor, trying to prevent pulselessness, trying to prevent fluid imbalance. For example, patient presented with hypotension. The factors to consider when it comes to prioritization. You have your ABCs, you have your stable over you have your unstable over stable, you have your acute over chronic. These are the things you should consider when it comes to prioritization. Then when a cardiopulmonary resuscitation is needed, it's necessary that the ABC is being reversed. So you now have circulation, breathing, and then airway, if that makes sense. Sorry, you have the CAB, circulation, airway, and breathing. Sorry. So you want to make sure that the circulatory system is in order, followed by the airway, and then the airway, when it's in order, it will now help in the breathing. So it's vice versa, if that makes sense. When providing care, the nurse needs to decide which needs or problem require immediate action and which one could be delayed until a later time, like I said earlier on. The nurse considers client problems that involve actual or life-threatening concerns before potential threatening concerns. For example, maybe a patient has a fracture and then syndrome, which is pulselessness, pain, pain, person, and you don't, patients will have compartment syndrome, and it is irreversible. Patient can lose his limbs forever, and as a nurse you don't want that. As a nurse, you've not saved your patient. Patient safety is at risk. So when a patient has fracture, you have to look at these signs and symptoms and isolate them and do what needs to be done ASAP to avoid life-threatening conditions. Also, problems, it has a short form, which is the ADPI: assessment, diagnosis, planning, intervention, and evaluation. Prioritization may be different in disaster or emergency situation where an action should be taken before gathering further information. So I'm trying to look for an example to give. Okay, so for example, you're trying to carry out an action before you take history, right? What example can I use to explain this? What I'm trying to look for an example to use to explain this particular point I gave. What is actually coming to my mind right now? Nothing is coming to my mind, but I just hope you get the point. So, where you need to carry out an action even before gathering further information about the particular person, if that makes sense. So let's see if we'll see questions that we can relate to and answer them. Okay. So this question says, the nurse is assigned to care for 4 clients in planning client rounds. Which client should the nurse assess first? Whenever you see this kind of question, you know it is a prioritization question, and you bring in these principles that I mentioned earlier to answer the question. Number 1, a post-recent surgical incision. Number 3, a client scheduled for a chest x-ray after insertion of a nasogastric tube. Number 4, a client with asthma who requested a breathing treatment during the previous shift. What do you think the answer to this question would be? Let's take it one by one. So number 1, a post-op client preparing for discharge with a new medication. So you've seen the word discharge, you know that this patient is stable. For this patient to be discharged, it means this patient has been certified stable and good to go home, right? So it's not an emergency. It is not an emergency, so this patient can wait. Then number 2, a client requiring daily dressing changes of a recent surgical incision. A client requiring daily dressing changes of a recent surgical incision. Okay, so this patient has a surgical incision that requires daily dressing, but do you think it's an emergency? Do you think it requires prioritization, or do you think? I don't think so, because it is not an immediate need. Obviously, if it is a daily dressing, it is going to be dressed at the end of the day. It's going to be dressed before the end of the shift. So it is not it's not the nurse. How will I put it? It is not a prioritization at this point. Then number 3, a client scheduled for a chest x-ray after insertion of a nasogastric tube. So you know that an x-ray it wasn't mentioned that the patient is to be fed at the moment. If it was mentioned that the patient is to be fed at the moment, good and fine. You have to, requested airway breathing circulation should come to mind. And also, this client requested, it means that this client is in obvious respiratory distress. For the client to have requested a breathing treatment is the answer. A client with asthma who requested a breathing treatment during the previous shift. So it means this patient is actually, if that makes sense. Okay, so another says the nurse employed in an emergency department is assigned to try clients coming to the emergency department for treatment on the evening shift. The nurse should assign priority to which, for treatment on the evening shift. The nurse should assign priority to which client? Number one, a client complaining of muscle aches, a headache, and a history of seizure. A client with a minor laceration on the index finger sustained while cutting an eggplant as a source. So this is a whole lot. This is actually a whole lot. Now let's look at the options. First of all, a client complaining of muscle aches, a headache, and history of seizures. Does this client require priority amongst the four? Okay, let's look at it. A client complaining of muscle ache, headache, seizures. So when it comes to the muscle aches, headache, seizures, what do you do at this point? So you're trying to like factor in the signs and symptoms and know what this patient might be suffering from, right? Yeah. So patients with like simple patient with simple conditions such as maybe fracture, asthma, respiratory distress, and all of that, they should actually be considered because this is under the airway breathing and circulation. But then they are classified as urgent priority. We have the emergent, we have the urgent, and from the, what do they call it again? From the rationale here, it says clients with conditions such as a simple fracture, asthma, without respiratory distress, without clients complaining of muscle aches, headache, and history of seizures. So this patient already has history of seizures, and maybe this patient had an, okay, the question already said that this patient has history of seizure. So maybe the patient has seized and is not having muscle ache, having a headache due to the seizure. It's not an emergency. It's also not an emergency. In this, it's under the second priority. Now, a client with minor lacerations on the index finger sustained while cutting an eggplant. The question already told you it's a minor injury, so it doesn't require priority. It just ate pizza that was made with a very spicy sauce. So the client is complaining that, oh, immediately I finished eating pizza, I started having chest pain, and you don't want to ignore chest pains. When it comes to prioritization, chest pain is always number one because this is an indication of a myocardial infarction or angina. So you want to take it as priority, you want to take it with every alacrity in you. So that is the answer. A client with chest pain who states that he just ate pizza and it was made with a very after making initial routes and checking all of the assigned clients, which client should they not plan to care for first? Which client should the nurse plan to care for first? Should she start with amongst these people that were mentioned, that is being mentioned? Number one, a client who is ambulatory demonstrating steady gaits. Why are you prioritizing a client who is stable and demonstrating steady gaits? So that's how it. A post-op client who has just received an opioid pain medication. Some of these questions even answer themselves by themselves. Of 38.4 degrees Celsius. This question is actually very tricky. If you're not careful, you're going to miss out on the question. So now, first one says, a client who is ambulatory for signs and symptoms of you want to watch out for what they call it again, side effect of an opioid medication. You know, side effect of opioid medication includes reduced respiratory reduced respiration. So when you give an opioid, you have to watch out for reduction in the respiratory rate, because opioids bring down respiratory rate, and you don't give an opioid when the respiratory rate is from 10 cycles per minute down. Symptoms of opioids, good and fine, but then that is not the priority. And then a client scheduled for physical therapy for the first crotch walking section. So like I said, for every first of a patient, can wait, right? It's not a problem. Then the fourth one says a client with a white blood cell count of 14,000 and a temperature of 38.4 degrees Celsius. So for you to answer this question, you also need to know your lab values. So what's the lab value for white blood cells? When it comes to the Nclex, it is from 5,000 to 10,000. Yes, it's from 5,000 to 10,000 millimeter mercury cube. So now this patient has 14,000. That's like way too much. And then the temperature is 38.5. And you know, when a patient's temperature is on the high side, patient can begin to seize, a lot of things can go wrong. So this should be your priority. You have to prioritize this patient and do the necessary things by trying to reduce the temperature by sponging, exposing the patient to an airy room where ventilation, cross ventilation can occur, and follow doctor's order by prescribing antibiotics, which will help reduce the white blood cell, and prevent further infection. So that is it for this. Now, the next question says, okay, this is a delegation question. The nurse is giving a bed bath to an assigned client when an assistive personnel enters the client's room and tells the nurse that another assigned client is in pain and needs pain medication. Which is the most appropriate nursing action? Number one, finish the bed bath and then administer the pain medication to the other client. 2, ask the AP to find out when the last pain medication was given to the client. 3, ask the AP to tell the client in pain that medication will be administered as soon as the bed bath is complete. 4, cover the client, raise the side wrist, tell the client that you return shortly, and administer the payment to the other client. Which do you think should be the answer, or is the answer? So critical thinking is involved when you're answering an Nclex question. You have to think outside the box. You have to think as a registered nurse. You have to think critically as a nurse. Now, the first one says finish the bed bath and then administer the pain medication to the other client. What if you finish the bed bath and you go to the other client's room and the client is dead? What are you gonna say? What are you going to explain to the relatives of this client, or what are you going to explain to the management of the hospital that happened to this client? So you don't want to delay. Patient has complained and in pains. You want to go to the patient and know the kind of pain, the location of the pain, what is causing the pain. If there are medications to give, you want to give those medications. You don't ignore the patient and say, oh, let me finish getting this patient. Bathing is not an emergency, it's not a priority. So what you want to do at this point is not finishing with debating and going to answer the client. You might get there and patient is dead, and we are practicing safety when it comes to the Nclex. You want to be a safe nurse, so that is not the answer. Ask the assistive personnel to find out when the last pain medication was given to the client. That's not the job of the AP. You don't delegate that kind of duty to the AP to go and ask the patient when last did. How is the patient even supposed to know? How is the AP even supposed to know? So that is not the answer. And 3, ask the AP to tell the client in pain that medication will be. No, you don't do that. You don't tell the AP, go and tell the patient that medication will be administered. You don't do that. That is not safe practice. That is not safe nursing. And this patient might likely not trust you for the rest of that shift. Yeah, because you need to be the patient advocate. You don't assign the AP to go and tell the other patient that you want to finish up with debating and come and no, you don't do that. 4 is the correct answer. Cover the client, raise the side raise to avoid a fall. Tell the client in the room that you will be back shortly, and then go and administer that pain medication to the other client. And that's it. That is the answer. That is the most safest thing to do at that point. Now, this is another delegation question. The nurse manager has implemented a change in the method of nursing delivery system from functional to team nursing. Okay, no, let's ignore this. Um, this is a delegation question. The registered assistive personnel. Remember, I said, okay, let's answer it first. Client requiring a colostomy irrigation, a client receiving continuous tube feedings, a client who requires urine specimen collection, a client with difficulty swallowing food and fluid. What do you think is the most appropriate assignment for an AP in this question? So now, let's take them one by one. First of all, a client requiring a colostomy AP to go and do a colostomy irrigation. An LPN can do that and not an AP. A client receiving continuous tube feedings, no, that's not the duty of an AP. An AP helps with oral feedings and not tube feedings. A client who requires urine specimen collections, this is the one an AP can do. An LP can assist in collecting urine specimens. Yes, an AP can do that. For a client with difficulty swallowing food and fluid, difficulty has already ruled that off as the answer. You don't assign an AP to go and feed a patient who has difficulty in swallowing. That patient will aspirate and you will have to answer for it. So you don't assign that to an AP. Following the rationale that was given here, a nurse must determine the most appropriate assignment based on the skills of the staff member and the needs of the client. Remember, that was one of the guidelines when it comes to delegation. It has to be the right person, and that person has to have the right skill for delegation. In this case, the most appropriate assignment for the AP would be to care for the client who requires urine specimen collections. The AP is skilled in this procedure, very skilled. Now, colostomy irrigation and tube feedings are not performed by APs because these are invasive procedures. Assign invasive procedures to an AP, to an AP too. I'm trying to see if there's any other. Okay, so this is another delegation question. The nurse employed in a long-term care facility is planning assignment for the clients on a nursing unit. The nurse needs to assign 4 clients and has a licensed practical nurse and 3 assistive personnel on a nursing team. Which client will the nurse most appropriately assign to the licensed practical nurse? 1, a client who requires a bed bath. 2, another client requiring frequent ambulation. 3, a client who requires hourly vital sign measurement. And 4, a client requiring abdominal wound irrigations and dressing change every 3 hours. Who do you think should be assigned to a licensed practical nurse in this question? So the answer here is a client requiring abdominal wound irrigations and dressing changes every 3 hours. Remember, I said the work of an LPN is to do wound dressing changes and also to do an LPN also helps with some invasive procedures, also gives some medications apart from the IV medications. So the answer here is frequent changing of requiring abdominal wound irrigations because an invasive procedure that an LPN can do, and also dress changes every 3 hours. So for a client who requires a bed bath, is the work of an AP, easy peasy. And other clients requiring frequent ambulation is the work of an AP. A client who requires early vital signs measurement, so an AP can do it. Like patients are already on telemetry, so the work of the AP is just to go there. For clients or for a patient who are very unstable. So that is left the registered nurse and not the AP. Please take note. So that is basically the questions I have for prioritization and delegations in this live video. So let me also read the rationale that was given here. So when delegating nursing assignments, the nurse needs to consider the skills and educational level of the nursing staff, giving a bed bath, assisting with frequent ambulation can be done by the assistive personnel. A land owner is skilled in wood irrigations and dress changes, and most appropriately will be assigned to the client who needs this care. So like I said earlier on, all of that was mentioned, AP can do, except for the irrigation, the abdominal wound irrigation, and dress changes. So an AP does not do invasive procedure, while an LPN does some invasive procedure, but not all. So I think we've come to the end of this live. That will be all for today. I hope you learned one or two things. I hope you're going to implement them when you're studying for the Nclex or when you're writing the Nclex. And I will see you in my next. How do I end live?